And let's start with the breast cancer first. So now, what is the breast, and why should anyone even care about the breast? Now, the breast is actually important to all of us. And why do I say that? I say this because, one, it is important for the continuation of life, because as like all other mammals, you give birth. Once you've given birth, the nurturer, in this case, the women of the species, have to nurture and provide adequate nutrition to the young so that they can survive, actually. And two, because the breast is actually a very prominent structure in the anterior body. There are some social benefits attached to it. Particularly with the women, there's some level of self-esteem attached to the breast. Take, for example, if you have a woman with a much more smaller breast, compared sitting in the same table with a woman with a much more bigger, the other woman feels as if I'm not attractive. I don't look, will any man come and marry me or something like that. So it's almost like it's a level of self-esteem. And two, for the men, it's actually considered a level of self-esteem. If a man has a breast that's more feminine than a man having a developed pectoral muscles, that's chest muscles rather. So why the ultimate question that we all are still going to ask ourselves, why should you breast? You should care about the breast, one, because it's during the lifetime of a female, especially from puberty to adult life, the breast actually undergoes changes. You know, your monthly menstrual cycle to pregnancy to menopause. The breast is going to be changing alongside all these things. And in that case, there are some people that come to meet me and come, doctor, I'm having breast pain. And I will just ask them, are you on your period? Yes. Why do you feel that the breast is fuller? Yes, it's fuller. So you can actually see that during the lifetime of the female, the breast actually changes in size. And then two, because the breast is actually very important to the females, particularly. 1 in 4 women will actually come to the general surgeon table or consulting room complaining about a breast symptom. So you can see it's almost like 25% of women are actually going to come and complain to you, even if you don't even say anything. Then 3, has a possibility of developing into cancer. I mean, which is the basis of this conversation. And I actually feel really a very underspoken conversation that we don't have. And 4, the men, so the husbands, they actually consider, this is a very funny one, actually consider the breast as a very essential part of their survival too. So the husbands will always tell the wives that the children are, they have the breast too, but it's actually part for ours. So the next question is, what don't they tell you? What would people not tell you about breast cancer? And the last point I made actually begs the question. Has anyone ever wondered how what a man goes through when he looks at his beautiful wife now with one breast cut off? Has anybody really imagined that scenario? It's really alarming. It's really alarming. In fact, about 25% of women with breast cancer will actually end up having anxiety, and 25% of them again will have and lack of sexual. And then the rest of the remaining 40% will have problems with their marriages. It's either from divorce, it's either from their spouse showing lack of interest in them, and marital issues. So you can actually see that they're actually very important, and nobody really tells you about these things. Then two, most women with breast cancer actually look healthier than they actually feel. Because the cancer, it doesn't really exhibit the physical symptoms, meaning you are losing weight, you are short of blood, and your face, everybody keeps complaining that what happened? We saw you were looking healthy today. Now you've lost weight or something like that. No, the woman looks completely healthy. So she doesn't even know that she has. That is why the breast cancer is very, very important that we have a conversation. And three, nobody actually tells you that breast cancer is the number one leading cause of death from cancer globally. Second only to colon cancer, that's cancer of the stomach. Nobody tells you that it's actually the leading cause of cancer. Then, and the funny thing is that even though it's a cancer, it has a very high survival rate. In fact, they've reported cases of almost 80% survival rate from diagnosis from a 10-year, meaning that if you were diagnosed let's say today, 10 years after, there's a very high survival rate, almost 80% to some people even give it up to 93% survival rate. And the remaining 7% is late diagnosis, spread, cancer has gone beyond what it is, it has already started spreading and all. So that is another cause. And then lastly, about 1% of men would die from cancer of the breast. Why do I say this? Men typically, like I said, the breast is associated with some level of self-esteem, particularly for the females. But men, if a man has a breast, the breast is associated with femininity. Like this, why would you have a breast and all? And that breast that the man has the possibility of developing into cancer. In Nigeria, is about 2 to 3% of men die from cancer of the breast, which is really very, if you really think of it. Then the next question is, how would you know as a woman, how would you know that you really have, or a man, you have breast cancer? How will I know? The interesting thing is that we can't really tie down a particular cause, but we've been able to draw association. We've been able to draw association with some risk factors that can actually promote the breast that will develop and actually eventually lead to cancer. And one of these risks, a lot of the time you hear people say that younger people marrying early, this is particularly for the women now, the career-driven women. I don't want to marry, I want to focus on my career. But that alone is one disadvantage, because breast cancer starts, the probability of you developing breast cancer is even more than 80% from age 30 first. So when you get to 35, probability increases up to 85, 90%. Once you are more than 50 years, it's almost 5% probability that you will develop breast cancer. So younger people are less likely to develop breast cancer, meaning from age 18 to roughly 29 will have a lower probability of developing breast cancer. But that being said, there are still some special subset of people within the age of 30 that can actually develop breast cancer. But just about 2 out of 10 women, which is 2 out of 100 women rather, which is about 2% of the overall cancer burden. Then we have genetics. Genetics has a role to play, because there are some subset of people who are more prone to developing breast cancer than others. The funny I don't know, I get this a lot, that this is something that we don't really focus on, because it's as if you inherited something from your mother and your father. So you are a composition of your mother, half of your mother and half of your father. So there are things that will actually get to you from the father's line and the mother's line. This being said, a strong family history, meaning that if your mother has it, your sister has it, your auntie had it, there is a strong possibility that you will have it too, because it goes in first-degree relations. So just imagine that even for the males too, if one person in the family had cancer, if had breast cancer, and another person still had it, there's a high probability that the man get the breast cancer to pure genetics here. Then the next factor that can be considered is age, the age at pregnancy, age at first pregnancy. Like I said earlier, there's an advantage attached to you pursuing a career, because your body is actually programmed to go on, continue life, reproduce, continue life, and you get to menopause, you start aging, and then the life cycle continues like that. So if you, for some reason, delay pregnancy to age 35, you are at risk of developing breast cancer. In almost 80%, in almost 80% of the case, that's 8 out of every 10 times, you are at risk of developing breast cancer if you had your first child at age 35. Then there are this subset of women that will decide that for some reason, I don't want to have kids. I don't want to have kids, the reason best known to me, I can survive in this world on my own, blah, blah, blah. That actually, we call it in medical term nulliparity, meaning that you've not gotten pregnant from birth till death. There is no likelihood of you getting pregnant because you made a decision, or sort of. That will actually put you at the risk of developing breast cancer. Again, breastfeeding is also associated with breast cancer, because we've seen that most women that actually breastfed their kids, if they have let's say 4 kids and they breastfed them adequately, the risk of them developing breast cancer is actually than those who decided that no, I'll give my kids water instead of breast milk. In fact, WHO advises you that if you are a lactating mother, you should breastfeed almost 8 times a day. So you can see that it's really very impressive that breastfeeding can actually provide some protective means against breast cancer. And not only with other conditions like pneumonia, breastfeeding can even prevent the child from having pneumonia, because the breast milk has a very high amount of protective chemicals or substances rather that can actually protect the young from actually developing these conditions. Then another likely cause of breast cancer is use of contraceptive pills. This is best decided by your physician, because if you want family planning, if you come and meet me, we lay everything down on the table. Why do we do this? Because there are some contraceptives that actually gives you higher risk of developing cancer, particularly breast cancer and endometrial cancer, that's cancer of the womb. So if you take some pills that you have to swallow every day for 28 days, you are actually at a higher risk. In fact, this was just yesterday here. I had a woman come and complain to me that she was trying to confirm what are the risks involved in taking. She showed me one particular contraceptive. I told her that you should stop it because she's been taking it for 12 years. 12 years. And that would actually have the risk of developing breast cancer. I just told her, you just have to stop it. And before then, she already told me that she already had a family history too. Her mother had it, her elder sister had it. And now I'm here delivering the conversation about breast cancer. So she told me that this family members had it, and you are already at risk. If your family member had it, you are at risk, and now you're not taking this contraception. So just prepare your mind first that this is what is going to happen, and Then another one we don't talk about is obesity. Now, obesity is, in fact, last week Friday was World Obesity Day. And the current stats that are in now is that more than 1 billion people of the entire 8 billion population of the world are suffering from obesity. So you can see that, obesity is something that we don't talk about. In fact, some women have actually called it body shaming. They use the big terms, use the fancy term, body shaming. Don't body shame me. I like myself. I'm confident in who I am. My husband will like me, or my partner will like me for. But is that really nice when more than 1 billion people are suffering from obesity? More than 50% of disease conditions can be avoided just by preventing obesity. You are at risk of developing breast cancer just so there are a lot of things that are associated with obesity, but we don't talk about those things. In fact, just to be precise now, I see this very common now, where some women, they prefer to have a larger breast, they use the word curvaceous. These are funny words that women use to describe their. So, but is having a larger breast good? The weight upwards is much more higher than the weight downwards. So if you are not only at risk of having chronic neck pain, because again you are going to bend to really contain the position of the breast. You are going to assume a position of bending, so you are going to strain your neck, one, and then two, the breast, the amount of fat in the breast has a risk of creating a favorable environment for you to develop breast cancer. So again, the men out there, if you see a woman with big breasts and you invest in her, is it a good investment? I would say no. Why? Because in the next couple of years, or in the next 10 years or 5 years or so, once she's crossed menopause, there's a very high rate of the fat tissues in that breast creating more comfortable environment for the breast to develop more frequently and then lead to cancer. So you see that you got the enjoyment at the early stage, meaning that, you got the enjoyment, you had a wife that was very curvaceous and all, but later in life, you are suffering from the repercussions. Now she has breast, you don't know what to do, it's really not the right place to. Smoking is never good, smoking, but I think that these days I've seen more women than the olden days. It's really very funny now that women are adopting the lifestyle of smoking. Also, drinking alcohol can also put you at a higher risk. Then, again, if you've had it before and we removed it and it was just in one breast, there is a high tendency of you having breast in the other breasts. Usually after 10, 20 years, the risk becomes higher. So one history of breast cancer can also get you to have breast cancer on the other breast. So again, how would you know you have breast cancer as a lady? If I'm most women, like I said, it's almost a no-brainer. My breast is paining me, even just during the menstrual period, and they're just having this breast pain. They will come and report to you. So, but the commonest symptom that women do present with is a lump in the breast. this is actually discovered when maybe the woman is showering, for example, and she just feels something out of the ordinary in her breast. She will touch the other breast. I don't feel this thing yet, but there's something there. The next day, I can assure you, she will drive down to come and meet you. Doctor, this is what is happening to my breast. I don't come and check it. So they will always come and complain to you about that. So now, other things that can happen with the breast is that they can also be nipple discharge. And this discharge is not the normal milkish color. It can be almost bloody. So you can have a blood-stained discharge coming out from there. And then you can also still have pain. But usually the typical description of lump that women with breast cancer present with is painless. It does not disturb them, but there's something hard there that they feel. In, let's say, 1 in 10 cases of breast cancer, there's also associated pain with it. Then other symptoms that they can have is if the breast has developed and has spreading. So they can come with you with back pain, low back, because it's spread to the bone of the lumbar region, as your waist region, to spread to the bone, it can be the lungs, it can spread to the brain, so it can come confused. Some of them may come with seizures, rather. Some of them may come with seizures. So, question of the day is now, once you've discovered, what do you do from here? What do you do? And I always tell people this. First thing, that's why you have doctors around. See your doctor. Don't Google your symptoms, because it's very common. A lot of people think that they have knowledge. They know because of the internet. I mean, when the story I always put about the internet is that when the internet came, pastors were telling you that the internet is the devil. I used that. It was very funny when you were telling you that the internet is actually destructive, but revolutionary is better. I mean, we have churches taking their sermon online now. So, but the question is to make things worse. See a doctor. And once you see the doctor, what will the doctor do? The doctor will carry out his own clinical examination of the breast. So if we don't confirm, we'll listen to you first, know what you're talking about, we'll do our own examination of it and see for ourselves. Then the next thing is that we send you what we call a mammogram. Big word, but it's
We can no longer hear you. I don't know if it's the same doctor with other people.
okay, good. All right. So the next thing is gotten adequate knowledge about what it is. We've determined that this thing is actually cancerous, and we've checked it, and you came early. The next step is what would the doctor do? They actually give you lots of treatment options, from medications, and it can be up to surgery, depending on at what level you present. So the medications that we give, we can actually give you medications. Hello, can you hear me? All right. So we can give you medications to actually prevent you from having excessive female hormone, which can be produced from the breast. Like I said, people have a lot of female breast tend to develop breast cancer because they produce more female hormone. We give you drugs to actually regulate that hormone. Two, we might actually put you on chemotherapy, and chemotherapy does not go with risk. So if for example you present late with the disease, and we see that if we do surgery, the risk of you surviving is still low, we'll just place you on chemotherapy, and it can slow the growth of the cancer cell. It can guarantee you added 1 or 2 years of life, and it can also still be used in adding with surgery. So once we tell you about surgery, there are two types of surgery that we might actually call. Again, for women who present early, those women have the benefit of what we call breast conservative surgery. So meaning that we can go in, we take portion of the breast, or we can just remove the lump that you are complaining about, and you still have your normal breast. So nothing really changes there. If you present with a more aggressive stage of the breast cancer, we will have to do a complete removal of the breast. And this is the disadvantage that most women stand to gain from breast cancer, because this actually affects psychology. I said 25% of them will enter anxiety and depression. 35% of them will have decreased low self-esteem and low sexual drive. So the woman is actually very, very sad. The thing that gives a high level of esteem has been removed.